Hello, everyone. Today, our fiction book club is welcoming Professor Dr. Mack Burke. He is a faculty member at Heterodox Academy, like myself, and that's where I first interacted with him. Dr. Burke is a professor of educational psychology at Baylor University School of Education. His areas of interest include special and inclusive education, disability, with some emphasis in behavioral disorders and school-based mental health. His expertise perfectly aligns with the International Day of Persons with Disabilities, which is today, December 3rd. In today's session, we will try to cover 5 things. Number 1, Dr. Burke's current preoccupation. Number 2, UN Convention on the Rights of Persons with Disabilities. In the words of United Nations official website itself, this convention takes to a new height the movement from viewing persons with disabilities as objects of charity, medical treatment, and social protection towards viewing persons with disabilities as subjects with rights who are capable of claiming those rights and making decisions for their lives based on their free and informed consent, as well as being active members of society. These are indeed very lofty words, as the United Nations words always are. On third part of our agenda is to talk about roots of dogmatism in general and in academia in particular. Since we both are heterodox academy members whose aim is open inquiry, viewpoint diversity, and constructive disagreement in institution of higher learning, our fourth topic would be freedom of expression, freedom of speech, and cancel culture. We are going to conclude with Dr. Burke's favorites and recommended books of fiction and non-fiction. So, Dr. Burke, first, please tell us about your work and Bear Lab that you are establishing or have established, the Behavioral Education and Assessment Research Lab.
Well, first, thank you so much for inviting me to share with you. I think this is the first time that I have done this particular format, and so you have all my respect. So I can tell you a little bit about my work, and there's a couple of things probably to preface it or to think about as I talk about my own particular work. And that's first you should is that I'm coming at things from, of course, from the United States. And then within the United States, we have our own country. It's called Texas. And so you have to frame it from that perspective as well, is that there are you sort of have local, regional, state, country, and then all the way up to the United Nations kind of frames, and depending on how you're looking at things filter through differently, right? So there are some caveats, right, to all my discussion. So first, let me give you a little bit about my background. My original background is actually my undergraduate degree is in history, and I was wanting to be a history professor until I learned that you had to learn how to translate in a second language. In this case, I was very interested in the Greeks, Plato, Aristotle, Socrates. And they told me that I had to learn Old Greek to do the original translations, right? And my wife would say that I can barely speak English and I only have one language. And so I went into a holding pattern, right? Working with trying to figure out what in my 20s, wanting to figure out what I wanted to do with my life, like many 20-year-olds do, and started working. Just as a holding pattern with individuals with, we would call them at-risk youth. Many had emotional and behavioral disorders associated with a psychiatric clinic. And then from there, I got hooked on the research end of things. And that sort of led me into that path into academia through mainly through educational psychology and taking a scientific or empirical approach to disability and mental health issues. And so that's kind of another framework that I'm coming at it at, right? And so that I'm more or less operate from an empirical framework for not necessarily as the big kind of ideology, but more as a tool to try to understand and develop effective approaches for working with different populations that are that we want to help. So having said all that, yes, sir.
Just one question. You mentioned empirical approach. So do you mean you perform experiments, or you let things happen naturally and you observe them? So do you experiment
both.
or?
Okay. No, both. I probably, within the continuum of an empirical framework, I was prepared in what might be called the scientist practitioner model, and that we are very invested in this idea of translational research, translating what we see as research, hopefully high quality research, into practice. And so I sort of bridge both, one foot into the research generation piece, but then this other piece where I'm asking myself, okay, here's what the research literature says, here's what the literature summaries say, here's what the meta-analyses say. How can we take that and see those as signposts for a direction to go in and translate that into practice with the populations that I'm most interested in? And so we've been very heavily impacted, even in our particular field, by the evidence-based practice movement. And so almost every field, at least, is asking themselves, what does evidence-based healthcare look like? What does evidence-based social work look like? What is, I go to, at my gym, there's a sign on the wall that says evidence-based workouts, right? And so everybody's asking themselves, trying to bring a scientific approach to bear in order to improve the human condition, right? And so so we've been very much, and I've been very much impacted that, but probably to answer your question is I have a foot in both worlds, right? The research world and then the translational piece to practice.
Okay, excellent. And whenever you use the term population, you study the population, you mean persons with disabilities, right?
That's right. And so that's one key area to think about, is that that disability is defined differently, and there's different categories of disabilities and different conceptions of disabilities depending on what part of the world you're in. So in the United States, we have 13 different categories of disability. Some are very readily apparent. So say somebody who's deaf and deaf, or has a visual impairment, or has a physical impairment, or is in a wheelchair. But most of the students that I work with have sort of the unseen impairments, right? They oftentimes have maybe we separate in our particular field, we separate those that have problems in the externalizing domain from those with internalizing domain. And so those that have externalizing problems are the ones you probably think of as are getting in trouble, right? They get in trouble with law, they have problems with authority. There's a whole, we think of from a DSM perspective as being antisocial personality disorder, oppositional defiance, and so forth, right? And which, when we think of those, we oftentimes it's differential, right? We think of disproportionately impacting men, or young boys, or boys and adolescents. Those are the, when we think about internalizing problems, right? We think of disproportionately impacting women and females. So there's some gender issues, right? If you think about people who cut themselves, people who are having problems with weight, and people have those sorts of things, right? Depression, anxiety. Oftentimes those are females fall in the internalizing domain. And so that's the framework. And sometimes those cut across into other types of disabilities, so there's comorbidity. but that's the general framework that I operate from, at least.
Okay. So is it fair to say that men are more prone to being violent, whereas female, they internalize the problem and they are more prone to being depressed?
I think violence is the next step down the chain, right? I think men handle their frustrations and express themselves differently based on probably. I'm not an evolutionary psychologist, but they might look at that type. I'm not a neuroscientist, right? So forth, right? Maybe they're socialized differently, right? But definitely, I think there are mean gender differences in the way that mental health is expressed and mental health disorders. And remember, when we talk about means, it's, you have overlap, right? So it doesn't mean that one person, just because you're a guy, you're not going to have depression, right? Or just because you're female, you're not going to strike out, right? There's overlap, but which means in general, right? A tendency, right, is how to think of it.
Okay. So you mentioned that in US, how disability is understood. So some of the aspects are pretty clear. There are 13 categories and some of them are pretty clear. Depression, violent behavior. So what are some of the definitions that that are contentious, that there is still debate going on whether they should be included in the disability category or not? Are there any?
So you have to probably one. That's a great question. So one that continues to be an issue would be some attention deficit disorder, right? Is not recognized as a formal disability. And then ones that also oftentimes receive criticism are mental health issues. And the other is probably things like learning disabilities. If you go, in part is because we don't have a really good mechanism or identification procedures to distinguish what's the difference between somebody who has, if you're a neuroscientist, what's the difference between somebody who has a wandering mind and somebody who has ADD? What's the difference between someone who has hasn't been taught how to read and somebody who has dyslexia? What's the difference between somebody who has, who is socialized into a gang and somebody who has a schizophrenia or a mental health issue, right? That you think of as biological in origin. We don't put people in MRIs, right? There's not a formal, we gather information and we make a judgment. And so it's a little bit different process, right? For those, whereas if you look at something like somebody who's deaf or hearing impaired, it's obvious, right? If you look at somebody who has a physical disability, right, or is in a wheelchair, that's obvious. And so those soft kind of, but to many of these people, those disabilities are very real, right? If you look at people who have experienced trauma, people who have experienced maybe sexual assault survivors, or people who've been in the military, for example, who have PTSD, or we have a project that we work with actually two projects. I collaborate quite a bit with colleagues in Germany. So they have a project trying to work with refugee kids who are coming over from the Middle East and resettling in Germany. We have a project here in the United States that I work with schools in along the Texas-Mexican border, where we have people who are traveling across an entire country, multiple countries, to enter the United States, right? And and the kids experience all kinds of crazy stuff along the way. But you don't see it, right? It's going to express itself in their behaviors as they enter school and try to readjust and acclimate and to this new life that they're having to lead. And so those will be kind of the gray areas, right, around areas of disability that are sometimes brought out, that we have academic debates about.
Excellent. And that's what Jonathan Haidt in his book, Coddling of the American Mind, I believe that's the title, I'm pronouncing it correctly, where he says we are catastrophizing different terms, and maybe we are over-medicalizing stuff. So is this a fair assessment that in the United States, at least, people are over-medicalizing different problems because life itself is tough?
That's right. Well, there's two perspectives on it. So one perspective goes back, and I can provide the person's name, that makes the case going back to the 1950s in the development in the additional categories of the DSM, right, or for psychology, which is the Diagnostic Statistical Manual, I think is what it's, and that was the case that they were making, is that you're basically turning life circumstances into pathologies, or psychopathologies, right? Having said that, there's also, we're in a very strange time. And so you can go the other end of the continuum and say that all problems, we're in these extremes, right? So some people will say, you could say that, and they say it's being used to say that those problems are just, there's people who, we get into this social constructivist stuff, where people will say that disability is a social construction, which means if it's not real, right? And then on the other end of the continuum, you might have people who want to say everything's what Haidt is responding to is that we're overdoing it. And so you have the ends, and so you have, you can see where it can lead, right? Is that everybody has a disability or nobody has a disability. And so, so one of our arguments is always, where do you draw the line, right? And what you consider, what's the severity of the impairment? How frequent does the impairment need to be? Questions of, intensity, frequency, those sorts of issues, right? Does it cross over into multiple life domains? And so those are a lot of the ways that you might think of trying to discriminate the two. But we're in a time that, if you have a parent who has trouble with their kids and they go to the doctor might just, that's getting better, but, might prescribe Ritalin or some kind of psychotropic medication as an intervention, where it might be just poor parenting skills. And so there's lots of concern about exactly what Haidt's talking about.
Okay. So you mentioned DSM. I believe WHO has a slightly different criteria. They name it something else. So before we move on to talk about UN Convention, so what are some of the differences? You use DSM in United States. You don't follow the WHO different classification. Is it true?
So that's correct. So you have three things going on. So first is that for the 13 different categories of disability in the United States, those are educational designations. And the key thing about it, those designations, are that it has to adversely impact educational outcomes. So that's different than the DSM conception. The DSM conception is much broader. So you could have someone who's manic depressive might meet the eligibility requirements for having a emotional disorder, but they hold it together in school, and it really only impacts them at home, and they may not qualify for having an educational related disability. So I work within we use the DSM to supplement, but because I'm a school-based person or education-based person, we driver for us is the educational designations. And so we're focused on what's going on at school mostly, and trying to support those students in schools and keep them academically engaged and in school and not out.
Okay.
The third piece that you're asking about is really where the conception of disability is quite different in the United States than what's the UN agreement. And in part, in the United States, we typically, our 13 categories of disability reflect a medical model, right? The idea of diagnosis and the idea of identification and diagnosis and intervention based on those diagnoses. So if you have a learning disability, right, then, you know, or maybe a diagnostic prescriptive model, right? So if you have a learning disability, right, in say reading, which the classic idea of dyslexia is that you have a individual who is of normal intelligence or higher, and they have difficulties in written expression, reading, or mathematics due to some unexplained discrepancy in that, right? In other words, they're intelligent enough to do the work, to do these very simple skills that everybody seems to be picking up, but they're not learning it, or can't learn it, or having problems learning it. That's kind of the classic notion of a learning disability, right? And so there will be a intervention plan that will be put together based on that, for example, category. The UN agreement's quite different. The UN agreement's is not based on a medical model. It's based on more of a social model of disability, which comes again from the social constructionist piece, which leads one to the idea of, it's where you get these words of ableism, for example. And so from that perspective, it leads one not into a direct intervention model, but into an accommodation model. So the idea is that you would accommodate the disability, but you wouldn't necessarily take affirmative steps to intervene and provide what we might think of as targeted instruction or targeted intervention around that disability. And so that's quite a different idea. Maybe the way to think about it would be is if you had back pain, right? So I had back surgery, right? And so one way to think about back pain is all of a sudden you can go and see a person who can show you how to move differently, and you can make accommodations in your house, right? You could maybe get a cane. You could do all these things to accommodate, but it doesn't take away your back pain, right? Maybe a direct intervention would be physical therapy, right? So we do 6 months of physical therapy, and if you're non-responsive to that, then then maybe it's a surgical intervention. But you're taking affirmative steps to address the disability itself. And so those are two big distinctions, right? In the way that disability is being conceptualized.
Okay.
It works, so if that makes any sense.
Okay, so to take away your back pain, direct intervention would be diagnostic prescriptive model.
That's right.
And adjusting it would be social constructionist model that UN has defined.
I changed the environment in such a way to accommodate it.
Okay. And you mentioned that you are only interested in those disabilities that lead to poor educational outcome, not the rest of the stuff.
That's correct.
Okay. Okay. Now let's move on to United Nations Convention. So you already alluded to it a little bit, but please define for us some of the problems that you are facing because of those definitions. Where do they clash with your own understanding of persons with disability and their problems?
Sure. So one area that we've been writing about has been on the conception of a disability. So using so the UN model is very much based on this idea of a social model of disability, not a medical model. And so the social model of disability really de-emphasizes the idea of a disability and the underlying characteristics associated with it. So the idea is that and very much embraces this idea of ableism. So maybe a good idea was that I'm right-handed. They would say the world is made for right-handed people, and by virtue of being left-handed, right, the world discriminates against you. And so if the world was made for people who had left hands, who were left-handed, then you would not have a disability. Sort of something that's an analogy, right? Sort of the idea that if the world is made for the able-bodied, and since it discriminates against those who are disabled, and if everybody in the world were in a wheelchair, then you would not have a disability anymore.
So that's literally coddling of people's minds. There are some realities, those are harsh realities. I wouldn't want those realities to fall upon even on my worst enemies, but there are realities and there are disabilities, because we call them persons with disabilities. But instead of course, you have to be polite about it. You don't need to be blunt all the time, but you sort of coddle them. You cushion your language, and not only your language, the entire process has shifted toward social constructionism. Just like you adjust the surrounding according to it. Do they prescribe any sort of intervention?
In the extreme case, no. So one of the pieces right now that we're kind of driving us crazy is the neurodiversity movement. And so the idea of the neurodiverse is that would replace the idea of disability with the idea of difference, and that differences fall on a continuum, right, a distribution, and that people would not have a disability, they are simply different. And in the case of the neurodiverse movement, even mental health disorders would be considered difference and not disability. And so the idea, if you go to mental health, there's people who are having controversy, it kind of goes also with this idea of normalization that comes out of the normalization movement. So people with schizophrenia, for example, or that I would say have schizophrenia, they might say don't have this schizophrenia, they're simply neurodiverse, right? And so and the other place that it leads to, so I'm going through my list of things that are kind of driving me crazy, right? Is that as an anti-intervention and movement or approach, where we say their idea is don't fix me, this is who I am. And so, okay, so if you want to say that about somebody who's quirky, it's no big deal, right? If you want to say that about somebody who's has ADD and they don't fix, okay, that's fine. But schizophrenia and bulimia and some of this other stuff, if you have suicidal ideation, do you want me to say, oh, don't fix me, right? And so it's so that's really so that's one piece, is that what is a disability, right? Is there a disability rooted in an objective reality, right? Or is it a social construction that is mediated by social and environmental factors? So, and so that's, I don't know if that kind of makes sense, but it leads you to different places in the way that
it makes perfect sense. You are not allowed to say that higher body weight can lead to diseases. You have to just accept it. If you're not accepting it, if you are trying to intervene, if you are trying to say to the person, reduce your weight, go for exercise, then you are talking about intervening. And that's not what social constructionists are saying. They are saying you need to adjust your model. that is just one form of living, which is as legitimate as the person who is exercising regularly and taking good care of his diet. So, did I summarize it correctly?
No, that's right. And that's actually referred to as the body positivity movement, right? We kind of accept who we are. If I'm overweight, and I am overweight, right? Maybe I go to my doctor tells me I need to I need to watch my cholesterol, bring my blood pressure down, and watch diet and exercise, right? And I get all upset because he told me that that basically I'm too fat. So yeah, I mean, of course there's some truth to it, right? There's variation based on body types and stuff like that and all that sort of stuff. And people, and there is a sense that, like, if you look at the and I think Haidt talks about it as well, is that the impact of media and Facebook, and you look around, all these people are beautiful, they're all in shape, they don't tell you that they've been photoshopped, that they're taking drugs, that these models and so forth, right? And so you get a skewed sense of what normal is, right? Or we might think of as aesthetics.
Yeah.
And so I get it.
totally
That's
get it.
completely true, I think.
Yeah, I totally get it. So this is the mental positivity. One, we have body positivity. So this is the mental positivity that UN is trying to encourage.
In part, but that's not. I think. But so one is one issue is the social model of disability, right? That's contrasted with an objective, a more medical model of disability, and you can see kind of some trade-offs between both of them. Probably the second piece that is more ideological in nature is the goal of full social inclusion of people with disabilities. And that impacts us in schools because it's about including all students, all types of disabilities, in a regular education curriculum for all the day. And so the idea is that, and so it gets to where, and that makes sense. It might make sense for about 80% of the individuals with disabilities out there. But 20%, maybe 15, 5, I don't know, right? You have to think about on a case-by-case basis. If you think about the full range of disabilities, you say you have an individual with an IQ of 50 who is eating rocks, right? Or cigarette butts, or an extreme, it's a psychological disorder called pica. How is that student going to be included in certain settings, right? The other piece that leads to your goals. Your goals are now defined by what is you consider normal, which is different from the baseline of what the individual might need. And so a colleague of mine wrote a great paper about he works with different group of disabilities than I do, cognitive disabilities, Down syndrome, and so forth, about that the students can identify Mars, but they don't know how to tie their shoes. Is it important to know about Mars? Yes, of course. I love science. But if you can't use the bathroom, tie your shoes, self-help skills, right? I don't know what you do. And so, there are only so many minutes in a day from an educational perspective. And so how do you want to spend your time? So that's the other piece, right? Is that it shifts both the conception of a disability, or probably if you're in a medical field, maybe even the conception of an illness, the sort of standards by which you are going to develop an intervention plan and judge the effectiveness of the intervention plan are quite different as well. And the focus is really is on bodily inclusion. Bodily inclusion is different than an improvement in outcomes, right? That's one type of outcome, And certainly one, I'm not anti-inclusion, right? Right. Very much, for inclusion in principle. But if the focus can't only be on bodily inclusion. And so I think so sort of the big eye of inclusion, right? Yeah, I'm very much for, but you have to think it through based on an individual case-by-case basis. And so we get into this idea of group-based decision-making versus individual-based decision-making that we have to sort out, at least in my particular area.
Okay, so the people who are basically planning it and pushing it forward, have they never been to any class? Have they never interacted with these students? And don't they know that if you have students who have uh, a little bit aggressive behavior, so they are not just different, they are just they may disrupt the entire discipline of the entire class. So would you term it as a tyranny of niceness?
Yeah, I don't know about tyranny of niceness. I think we're always, I think so in my particular field, we all go in for matters of the heart, right? No one, we go into based on very, very noble and idealistic reasons. And then we're confronted with realities. And so, and oftentimes when we're working with atypical populations, not typical populations. And when you work with atypical populations, oftentimes there is no good answer. Instead, the answer is bad and worse. And that's your choice. And trying to pick about what the least worst course of action is. Does that make sense? And
trade-offs. You have trade-offs.
Yeah, and none of the trade-offs are good. It's bad and worse, right? And so, yeah, and I think the people using the language, very great language of the UN, for example, I think those are aspirational goals. I think, and they play out differently, probably depending on which country you're in. But the goal of full inclusion and all is all, I think you have to look at it on, I think as an individual basis. And in the United States, our worry, so this is one of our big worries, is that many countries do have infrastructure set up for individuals with disabilities. A lot of times they're based on, they are in segregated in separate schools, for example. So in Germany, there's a school for basically by each category, right? So if you have a, deaf and hearing impairment or something like that, you might go for a school for that. You might go for a school for those who are visually impaired. You might go for a school, so there, alternative school for each of those different areas. And so they're basically where we were in the 1970s, in the process of shutting down those schools and and transferring those and moving those schools, teachers, and resources into they're organized a little bit differently, but into their other model, their other school models. And so that's probably not a bad thing. I think for 70-80% of the students, probably with the right good accommodations, and that they will be success depending on the disability and so forth. The level of inclusion, even bodily inclusion, will be impact and be a positive thing for our own outcomes. I think it will be good for the students. That other 20%, if things don't work out, we always worry. I always think worst case scenario. If things don't work out, what's the plan B? And sometimes what's the plan C, D, E, and F? And so that's what I worry about when you close down this sort of continuum of services to only focus on one type of service in one type of setting. And so that's one. And we have in the United States a cautionary tale, and that's that the institutionalization movement in the United States occurred in the 1970s. And so basically in the area of severe and persistent mental illness, you had institutions set up, and many of those institutions were really horrible. They needed to be shut down, they needed to be reformed, and so forth. But what happened, the idea was that you would shut down those institutions and redistribute these resources into community-based settings. And that never really happened, right? Or later administrations sort of cut the funding, or all kinds of weird things happened along the way. Whatever, there was no, the end result was there's no services. And so now if you look if you go visit, places in the United States, you see homeless people, you see a lot of the people, same kind of people that would have been in those institutions. They're not families that are on hard times and are homeless a lot of time. I would say most. They're people who have mental illness problems, right? And they're homeless and they're self-medicating with drugs. And they get picked up by law enforcement. They go into the jails. And so forth, right? And so our worry is that even if you have lots of criticism about, having alternative placements and alternative schools and alternative services that aren't necessarily in inclusive settings for a lot of these different individuals with disabilities, that if you take that away, you're having a lot of faith that there's going to be something there to replace it with. And the history is such that, at least in one critical area, it didn't happen. And so that's one of the things that a lot of us are quite concerned about.
Okay. So I have my own hypothesis, but I want you to answer it, that this United Nations Convention on the Rights of Persons with Disabilities, CRPD, Pakistan and United States, they both are signatories, but Pakistan has ratified it, but US has not. So you alluded to the fact that the language is a little bit troublesome. So what are your other explanations that Pakistan, being a third world country, it has signed it, ratified it, but US has not? I have my own hypothesis, but I want you to first say some words about it.
My interpretation is that it really conflicts the conception of conflicts with the way that our disability laws are structured. Our disability laws are structured around taking affirmative action based on a medical model. And if we were to sign on to the convention, then it would undercut those laws that are country specific. And so that's probably the rationale I would point to, because we have a different conception, at least currently. It could change, and it might very well change. And the trend is that it will change more towards what the UN has. That's the trend right now, and it's almost impossible to argue against, because in part is because that trend has been folded into the idea of social justice, disability justice, and civil rights for individuals with disabilities. And it's really hard to be a wet blanket and argue against that, right? Here I am saying, but what's the empirical basis for that, right? It doesn't matter, the empirical basis. What are the outcomes it's going to have? That don't matter. It's social justice. And I get where they're coming from, right? I really do. But we're trying to slow down the bandwagon and start trying to ask good questions along the way, like what are going to be the implications of we support, right? So I actually been working on a paper called privileging the empirical over the ideological, and for evidence-based social justice. And so if people just put those two words in front of everything, I could get there. evidence-based social justice, evidence-based disability justice, evidence-based mental health, right? I mean, I understand the goals. I'm idealistic myself, right? But you know, it's sort of Plato versus Aristotle, right? One's an idealist, the other is a realist, and you have to negotiate those two tensions.
Gotcha. Okay, so my hypothesis is that if US ratifies it, US will actually implement it. As far as Pakistan is concerned, we ratify a lot of stuff. We don't even have a wheelchair accessible parking in Pakistan. Most of Pakistan doesn't have this concept. A lot of time Google Maps ask me, does this place have wheelchair accessible parking? So 99% of the cases, there is no such concept of wheelchair accessible parking. So that is why we can ratify a lot of stuff. So since in US, laws are strict, if you ratify it, you actually have to do something about it. Since we don't have to do anything about it, so we can ratify a lot of things. So this is just my understanding of the things. One should be critical of one's own, circumstances as well. That's how you improve. And I have noticed one great thing about generally about Western culture, or you call it US culture, a lot of introspection. Introspection is good, but sometimes you go too extreme. Sometimes I feel some sort of nihilism as well. So can we take a few questions?
You won't disagree with that. Well, I mean, I don't know. So I'll tell. So I can tell you the same thing that. Yeah, it depends. I guess it's the eye of the beholder, right? And so I'll say the same thing that say to my German colleagues, right? Is that yeah, I mean, we have our issues, and so yeah, pick what makes sense and discard the rest.
Great. Okay, so we have a question from the live stream, and the question is from Asmatullah Khan, and his question is, can mental health disorder be inherited from parents? So if you like to answer it, you can.
Oh, I think so, absolutely. And I think if you go over to the psychiatric side and those who operate, absolutely. I have a colleague who at another university who does twin studies around dyslexia and reading disabilities, trying to tease out, the variance that's associated with genetics versus environment and its impact on learning. And so I think you can absolutely point to medical and biological determinants for, but there's not a clean line, right, in this nature versus nurture causality, I think, that is easy to distinguish, right? What's the difference between the garden variety kid who doesn't know how to read and has learning problems versus that one who has learning disability? I think even though I think learning disabilities are quite real, and if you do a case history, you'll oftentimes find parents and grandparents and so forth as having very similar issues, even if they have formal education. I have a cousin she's married from somebody from Turkey, and their kids, they live in Georgia, right? Here in the United States. She's a mechanical engineer. He's a software engineer. Their son, can barely write his name, but he can code all day long and do math. How do you explain that? I don't know. Yeah, but I think if you go to different fields other than mine, you can absolutely point to that what you're talking about.
Okay, we have another question from Nehal Salim. She asks that what is intelligence and why do intelligent students fail to score good marks?
Oh, that's a great question. I wish I could answer. I am not so intelligent myself. And so I am so happy not to, because what I've learned from working in this particular area is that if you are extreme in one area, there's a trade-off in another. I don't know how, there's no research to support that, but that's been my experience. So I'm happy to be average in some areas. Fall in the curve, I'm happy to be right there somewhere in the middle, right?
Okay.
But yeah, I mean, you know, why do kids who come from good families get into trouble? You know, it happens, right? Even the best families, then, you know, I work with some, you know, friends of mine in counseling psychology, you know, do therapy with some great families. They're very solid. And so why does that happen? I don't know. But one you could think of, I think you have to look at it from my perspective, which is a very much an individual level, right? So if I were working with somebody whose kid was having trouble in school, and there wasn't intelligence issues, right, and so forth. I mean, you got to look at motivation. You got to look at match of the curriculum with the student. Some very smart students are very lazy because they're smart, right? They know all the shortcuts, right? And so they don't have to work so hard. And so it's much more fun to do whatever, right, than do work, you know, what they consider busy work and beneath themselves. So it just depends. You have to look at, you know, but yeah, if you figure that out, contact me, right? And because I would like to know too.
Okay, so I have another question. Do you have some sympathy for the thesis of blank slate? So what could be the rough proportion that this much is blank slate, I have to make my own destiny, and this much we do have some you know, genetic imprints in our personality? And maybe this may be a segue to another question we have from live stream, that how to apply classical conditioning on bipolar personalities to make them learn. So how much of this is malleable?
Yeah, that's a great question. So I think so this is more, I'm not going to talk about it from, I wouldn't respond from research perspective, but kind of a big picture philosophical one. And it's something that it's been not just in our field, it's been, you know, talked about for a very long time. So I look at it as 3 areas. So I was trained as a behaviorist, and specifically as a Skinnerian. And I've long since rejected that, not completely, but the problem that I have with a Skinnerian approach or with a radical behaviorist approach is this idea of environmental determinism, right? That your environment determines your destiny. I think it does in part, absolutely, but I don't think in the and so one sort of 3 buckets, right? One is this idea of environment and its impact on behavior. The second is going to be some of your genetic makeup that, you know, I mean, I'm never going to be a basketball player, right? 6 foot, 300 pound basketball players don't exist, no matter how hard I try. You know, and so part of that's going to be, and then that manifests itself in all kinds of ways, in personality, intelligence, and probably a lot of the other different characteristics that I'm not aware of. Probably your health, right? Some people are genetically predisposed to certain types of diseases, for example. And then, but we think about things in terms of mediators also. So what mediates those relationships that are associated with the environment and those and genetics? And that's really where I think an interventionist like myself has to focus on. Can we identify things that are manipulatable? I can't pronounce it. Changeable, right? In order to both help the particular client, student, individual we're working with, as well as what are the things that the individual themselves can do in terms of agency and self-determination to improve their circumstances. And so if you want to use the diet approach, right, you know, Yeah, is it nature or is it the environment that I have high blood pressure, right? Certainly my eating habits aren't the greatest, but I'm in an environment that, well, I mean, Texas is known for meat, right? We're meatitarians, not vegetarians. And so, but what's the mediating factors? What can I do about it? Well, not eat so much meat. That's something that we can I can work on, something I can change. I might need some help, some external help. So that's really, I think, where we have to go with it, right? Is not being if you're going to be deterministic, whether it's going to be religious determinism, environmental determinism, genetic determinism, that's awfully nihilistic, right? And it probably, yeah, all that's going to be good. There's a place for all that. Don't get me wrong. We set realities as they are, but we have to focus as an interventionist. If you're going to be an interventionist, you have to focus on things that are changeable, and they're changeable to improve an individual's circumstances, your own or somebody else's. And so that's, I think, where you have to focus your efforts.
Okay, can we take 2 more questions?
Oh, sure.
Okay, so we have a question from Arij, which basically revolves around interventions for people with autistic problems. This is one question, and second question is from Nadir. He wants to know, is there anything available like anti-aging stuff for mind, that your mind remains sharp? So what could be some of the interventions that you could recommend for autism and aging?
Yeah, aging, it's not really my area, right? My doctor tells me to stay in shape, work out. There's all these web-based stuff you can do now, but the research isn't very good on improving cognitive outcomes. My grandparent, my father-in-law and mother-in-law, they do crossword puzzles. But I think there's probably research to support that you need to stay academic, you need to stay engaged, right, till death. If you're going to both health-wise and mental-wise, if you're going to remain sharp as you get older. I think more and more. I think there is research, and it's not my area, that supports that more isolated people are, the more isolated they are, the less relationships they have, and so forth, right? The less engaged they are. Yeah, you meet people who are my age and they look and act like they're 80. And so I think there's probably some research to support that. If I remember some conversations with my counseling psychology friends who work with older populations. Okay. The autism question is a little bit closer for me. And so the primary evidence-based approach in the United States for autism is behavioral therapy. It's the one that insurance is reimbursing for. And so we do have, there's really a cottage industry now of behavioral clinics servicing individuals with autism. And the research seems to support that the earlier that you engage in intervention, the better, right? And so a lot of the research is focused on early intervention. So you see a lot of people engaged in research and intervention in early childhood, preschool, and so forth, because of the longitudinal studies that support the importance of early intervention on improving the long-term outcomes, which all makes sense. So probably what research doesn't support is sensory integration, which has a cult following almost, and some of the other therapies that are out there. And so you really have to do your homework, I think. And some things, there's a lot of different diets people try that I haven't, that have research isn't supposed so good about. But I think as long as you if I put myself in the shoes of a parent that has a child with a disability, and I think it's okay to try all kinds of different things. But I would prioritize those things that are have some evidence to support them. And then I would try to make sure that things that I wanted to experiment with, right, as form of therapy, didn't do any harm. And so, I give you like a good example. You think of Steve Jobs. He's a smart dude, right? But he thought he could cure cancer through diet, right? How does somebody so smart? Now, if you want to do diet and therapy, chemo and so forth, right? That makes sense to me. But he was able to afford the best doctors, the best treatment, right? But he was arrogant and thought that he could do the research himself and formulate a diet plan, right, that would cure, and it didn't. Now, would have the other worked? Who knows, right? But you want to do your homework. Another example we often use is there's this idea of that's out there is this idea of that for attachment disorder, there was a case, for example, of the idea of rebirthing therapy. And the idea is that the hypothesis, for example, was that if kids with attachment issues who were acting out would had problems because they didn't bond with the mother at birth, right? And so the idea was that the therapist would work with the individual to resimulate the rebirthing process, even though the kid was older. And then there would be a bonding process during therapy, and the child would rebond with the mother and the parents that they were missing when they were born. But we had a case where, the rebirthing process basically involved rolling the kid up in a carpet, and the kid died because he smothered, right? So you got to be careful about, there's lots of things that are out there that aren't so regulated, that don't have a lot of research, that are nice ideas maybe in theory, but you got to do your homework.
Yeah, you are absolutely right. So science is a self-correcting mechanism, and if there is no freedom of expression, so I'm shifting towards our fourth objective, third and fourth. So if you are not allowed to not allowed to say what's in your mind, and you have to ignore the obvious things, so how can science be able to correct itself, and what could be the future of it? So your thoughts on that, then we can, with your permission, we can take one more question, and then we are going to conclude the session. So what are your thoughts on this aspect?
Yeah, well, you can imagine, I'm operate from an empirical framework. And so even though I'm in a faith-based institution, I think that, regardless of your personal faith or whatnot, science is a tool you just can't ignore as a self-correcting mechanism for trying to do good things, or whatever goals that you're trying to. And it is a tool that can be used for bad things too. I always point out that Einstein wanted space travel. Instead we got intercontinental ballistic missiles during the Cold War. So you can go, it's a tool, right, for used for good or evil. And so but the process of a scientific framework involves debate. And it involves oftentimes debate between divergently different views. And that's within science, right? That's just within the scientific process, right? You have a hypothesis that's reasonable. I have a hypothesis that's reasonable. And we got to figure out how to reconcile that. We're not even there in my field. It's science versus non-science, right? And so that's really what we're talking about. I think we're not talking about debate between science and science, right? Competing hypotheses, right? We're talking about debate between the nature of reality, right? Whether and so that there's an objective reality or there is not. And so it's science or an empirical approach, framework versus a non-empirical one. I mean, that's I think where the debate is. And so we're not even to the science versus science. And so that's where I think we're at. And I think, one of the reasons why I'm like to engage, and I think the Heterodox Academy does really good stuff, is trying to bring some of that out. And so that's and it has to do with this sort of so the idea, so the way I think of it is you have the three different eras, right? You have the pre-modern, you have the modern or modernity, right? Which oftentimes is marked with the Enlightenment in the 1700s, from the Western perspective, at least. And then you have the postmodern times, which is oftentimes marked by the dropping of the atomic bomb. And the idea is that what postmodernists would say, or those that critique the empirical or science-based approach, is that there was a false belief in that technology and science could solve all the world's problems. There's some validity to that, right? And there's kind of this disillusionment after the dropping of the
I believe there was some distortion. So please, all of the participants, please keep your mic mute. Sorry for the disruption. Please continue.
Oh, that's okay. But that's kind of, like I said, Einstein wanted space travel, right? The good of humanity, and we got ICBMs in the Cold War. And so I think people, if I had to mark that where there started to be a disillusionment between the empirical and the scientific approach, and the confidence that people had in scientists, I think probably marks around that time at the end of World War II. And then in the 1970s, at least here in the United States and probably in the other Western countries, sort of this anti-science movement got merged into the civil rights movement, right? And the idea that there was a break, right, between, at least in academia, between what you might think of as the empirical left and the non-empirical left. And so which has continued to today, right? From the French tradition, you had Foucault, you had Derrida, you had all the French deconstructionists who thought that they could deconstruct reality, I think, sometimes. And so that's all that has just continued, right, all the way up to present day. And impacts, and us in academia, at least, in all kinds of different ways, and has led up, I think, to some of the discussions that we're having and so much trouble that we're having sorting out what's fact and what's not fact, or what's truth and what's not truth, or some approximation of truth. Because the presumption is this is kind of extreme relativism, where all facts are equal, or not even fact, all truths are equal. And all truths aren't equal, right? If you want to rank order them, we could do that. If you want to put them in different domains, that's cool too, right? I think Haidt talks about it does a nice job of separating it out into different telos, right? There's the telos for business, the telos for, medicine, the telos for philosophy. You get into trouble though when, one can inform the other, but you get in trouble when one supplants the other entirely, right? And so I think if you want to look at it different ways of knowing, but this idea that everything is equal, right? I don't think it leads you to it leads you into some very strange places.
Yeah, absolutely. And the link to Dr. Jonathan Haidt's Telos article will be in the YouTube description. Can we take one more question before we conclude this session?
Sure.
Okay. Aida, you can unmute yourself and you can ask your question.
Okay. So my question is that, can you hear me? Am I audible? Okay.
Yes.
My question is that even after doing every intervention, the standards and the guidelines, and after following each and everything in an academic environment or in general, child with disability still feels secluded. My question is coming from my personal experience. So, is the area is that coverable with therapy, or is just we are not following exactly the interventions? Is that area is because of that, or if it's just a lack of therapy, or it's just a natural course of things? But matlab, why the child is still feeling secluded from his or her fellows? So can you say about that? Yeah.
Okay, great. So if I understand it correctly, is that there could be cases that you could have an individual with a disability that you intervene, and in those interventions that you might put together, basically the individuals are not non-responsive, or something
Yes.
causing in such a
Feels
way
secluded. Feels
still
secluded.
is more secluded than what you would like, right? Or has to be served in some exclusionary setting, or maybe the family or whatever, right? So yeah, that's a great question. So I don't like either or, right? You'd have to look at the specifics, but I think most of the cases that I've been, you can improve a situation, right? And that's really what we're about. We're improving the situation. That's a little bit different than even though we intervene, or the way that, from a school-based setting or a disability-based setting, it's about improving the situation. It's not necessarily about cures, right? And so maybe that's a little bit different, right? Than you might think of with a medical model, right? I have high blood pressure. If I stop taking my medication, my doctor prescribes medication and it drops, but that's really not a cure, right? I still have high blood pressure. It's just, if I were to no longer take the medication, right? And so, but that's one, you have to kind of frame it from that perspective. And then you have to ask yourself, what are some of the factors that might contribute to more of an exclusionary context. So it could be the individual's behaviors are very severe, and if that's so they're going, if you're going to intervene in those particular behaviors, it might take longer to intervene, more of a sustained effort to improve the situation, and you have to kind of think about what improvement of the situation looks like for a particular individual. It could be that if the person started out as a shut-in, right, with the family, right? So lots of families, there's, even here in the US, there's a lot of stigma attached to having a child with disabilities, especially if there are physical disabilities or something like that you could see. And maybe the family doesn't want to be seen in public with the child, right? Maybe the child doesn't have any friends. Maybe it's, all these sorts of things, right? And so you have to kind of figure out what the domain is that you're wanting to focus on. Sometimes bodily inclusion is fine, right? Based on the particular individual and their needs and their goals. But it's, you have to sort of think it through at the individual level and what improvement looks like. You used the term exclusionary setting, right? But maybe if you move from, say, being in an exclusionary setting for 100% of the time to 50% of the time, that's a huge improvement. Even though the individual is, it's not 100%, but you're moving into a good direction. So we have to think of it in those from that perspective.
Okay. So we are moving towards our concluding section, and we have a one mandatory question, which is please recommend some of your favorite works of fiction and non-fiction, or some of the books that you want us to read to understand this concept, or any just tell us some of the books that you want us to read.
Oh boy. Yeah, you sent me that one and I was like, oh boy. Yeah, so you were so I was thinking about that. Like, so
Let's start with Higher Superstition, the book that you mentioned in the Heterodox
yeah,
Academy
I would
forum.
absolutely recommend I would actually, yeah, very much recommend hold on for a second. Recommend and I can forward these on you and you can share them, right? But so you, for me, I read broadly, right? So both in my particular field and out. It always helps me to take perspective of what's going on in my own field. But yeah, I would recommend Higher Superstition. It is in that was written by two administrators, I believe, from University of Virginia.
One was Live It.
Yep, and they are not social scientists; they're hard scientists. I think one's a mathematician, but they were writing about what's this crazy stuff going on that's impacting our field and trying to figure that out. And so and they are not what we think of as anti-science at all, right? But they're basically asking themselves, these people should be aligned with an empirical approach, but yet they're anti-enlightenment, anti-liberal, right? And so what do what's the stuff that's going on with them? And so I absolutely would recommend that for a historical perspective, which is quite good. I think you could probably even find a PDF one or something like that for free online somewhere. It's a great read, and has the more recent one has a forward by Skokel, who is which is great if you Google Skokel, Skoal, right? He is one time he's at NYU, he's a professor now at NYU. He's also a guy of the left, right? So politically, me and him would not get along, right? But we overlap very much because he's a defender of an empirical perspective. And he has some great readings that are online that you can access. One of his books is quite great, called Fashionable Nonsense. But basically what he did is submit a paper to one of his academic journals that really was nonsense, right? Using recursive language. So basically, and if you go online, he has links to, you can create your own postmodern article, right, electronically. Because the language is used is really intentionally obscure, right? And I love philosophy, don't get me wrong. And there are some philosophers you read and you reread and you read again and you say, I don't think they even know what they're talking about. That takes it to a whole new level. So you use words that can mean just, anything you want them to be. Yeah, I recommend taking a look at him for it really is, Haidt continues really in that tradition from my perspective, and his critique of some of the stuff that's going on. So those would be two. I like Jordan Peterson. Some people love him, some people hate him. He's a little bit he's closer to my area because he was a clinical psychologist at University of Toronto. I understand him quite a bit because one of my sub areas when I was a doctoral student was in personality, and so I understand where he's coming from his personality research when he talks about the big five, or personality characteristics associated with openness, agreeability, conscientiousness, extroversion, introversion, and emotional stability. So he has two sides. When you read, if you want to read his work, you have to understand from two perspectives. One is he has an empirical perspective around very solid empirical research around personality. The second perspective is more subjective, in that he's also brings in Jung, which can be a little mystical, right, and subjective. But I like him as well. And he's really tough. You have to remember that these people who go out like Haidt and Peterson and so forth, you have all my respect, really, because they put themselves out there as public intellectuals. And anytime, and you have to remember, in my own area of the way I was trained as a behaviorist, B.F. Skinner was a public intellectual, right? He was on the cover of Time magazine. You can find interviews with him. One of the reasons why the behavioral approaches and behaviorism, is much more debated than some of the others, is because he put himself out there as a public intellectual. And so someone who does that, you can guess, is going to also get all that's, all the arrows as well, and criticism, because they put themselves out there for public critique. And I would say that even with people I don't agree with, like Chomsky and some others that put themselves out there, which I think, you have to have a suit of armor on to put yourself out there as a public intellectual, some thick skin. Others that I like, that I think are really quite good from a Western perspective, I guess, is I would also take a look at Eric Hoffer. He's an older guy. I like the older people, but he wrote in the 1940s, 50s, he wrote The True Believer, Thoughts on the Nature of Mass Movements. It's Hoffer, Hoffer, talking about the growth of both fascism and Nazi Germany, as well as the other side, or twin side of the coin, which is Stalinism and Leninism and Marxism and the Soviet Union. And then, believe it or not, the person that I would also take a look at is Peter Berger. Berger and Logman in 1966 wrote The Social Construction of Reality, which is what social constructionism is based on. Interestingly enough, is why I'm a fan. And the reason I'm a fan is they articulated social constructionism still within a scientific framework and an empirical framework. Berger was actually a professor of sociology of religion, and wrote some really great stuff, I think, about religious pluralism. And both of them disavowed the appropriation of their work by the postmodernists that came later. It's kind of something that's a nuance that some people don't quite realize, I think. But yeah, they disavow themselves of the neo-Marxist appropriation of their work that came afterwards. So those would be, off the top of my head, the ones I would take a look at.
Okay, thank you so much. For the audience, the links to all of it and the chapter-wise distribution of all of this conversation will be updated soon in the YouTube description. Thank you so much, Dr. Burke. You have given us a lot of food for thought. And since I'm a religious person, so I'm going to pray that God will make you successful in your endeavors, in your scientific endeavors, because I think science is closer to truth. Science is one of the best mechanisms, one of the best tools to find the truth. So whatever truth may be. So thank you so much, and goodbye.
Thank you so much.